So in April 2015, the Council started to review the public health services that it commissions for children and young people, and also the services within children's centres that it commissions. This encompassed over 25 separate contracts. We wanted to get the views of service users and professionals on what they really valued in current services and wanted to stay the same, and what they thought needed to change. The key messages that came back from the engagement were that families would benefit from being able to see the same people for health advice during the very early months of a child's life, services being available in local community venues, more support during pregnancy, more contact with health visitors and children's centre services in the first year of a child's life, a greater focus on health support for children in reception year 1 and years 9, 10 and 11 at school, better mental health support for parents, lots of services for all families in the early years, but also allowing professionals enough time to work as needed with families with more complex needs. And the most important services for children of a school age were identified as being supporting vulnerable children, sexual health advice and emotional wellbeing support. We're really excited to be commissioning a new emotional wellbeing service, which we see as fundamental in bridging the gap between universal services and child and adolescent mental health services, but will also deliver direct intervention to young people, families and in group settings as well. We're investing more in early years services and increasing health visitor numbers in the county further. A new universal antenatal education programme will be available for all families, and it will be co-delivered by midwifery services, health visiting and the early years provider in children's centres. We'll have a team of children and young people's nurses whose focus is on delivering targeted assessment and intervention around children's health where there's no GP or specialist health involvement needed. We're going to increase the volume of online counselling services available for children and young people in Lincolnshire. We've already seen incredible take-up of this service, and it provides young people with a near instant access to support if they need it.
Lincolnshire County Council has been recognised as one of the best providers of children's services in the country, so bringing together the expertise in public health nurses and with our health colleagues will only enable us to do something better. These services have long been recognised as health services, both by the people who use them and our colleagues in clinical commissioning groups, and especially general practitioners. Therefore, it's really important that we've worked really closely with them to make sure that we're delivering services that will ensure brilliant communication across with that whole primary care team, and also look at ways that we can work together to both meet specific health needs of children where necessary, and again keep children safe where that's necessary. So those general practitioners, as well as providing health services, work as commissioners within clinical commissioning groups, and as such have just recently produced their sustainability and transformation plan, which describes the wider ambition for services in Lincolnshire to be of high quality, safe, effective and provided as close to home as possible, while being affordable in the wider system. And this again gives us a really good opportunity to develop services that will help us to achieve that. We see these services being part of a single management structure based within children's centres and other community venues as a real opportunity to deliver those joined up pathways which will provide really high quality services as close to home as possible. In the future, there'll also be opportunities, once those services are embedded, to work with the staff within those services and the people receiving the services to look at how we widen the opportunities. So, for example, health visitors delivering minor injury and minor ailment services, which will hopefully reduce the need for families to access their GPs or even hospital services. Again, providing a better experience both for families, but also benefits to the system in that the people who need A&E services, for example, will be able to access those more easily.
So the new model in Lincolnshire actually increases the amount of contact that children and families will have with trained health visitors and their teams, and that's again really important. We know that the impact of what health visitors can offer families in terms of advice and support really makes a difference. It's really critical that we get 0 to 19 services right for children and young people, and the reason for that is that we know that it makes a huge difference in outcomes to children throughout their lives. So as an example, that would be mental health and well-being, general health and well-being, healthy weight, social skills. All those things are actually really influenced from even before the time that we're born. Early support has been demonstrated to have much better outcomes for children and families, in particular mother and baby. So an example of that would be breastfeeding, another example is mental well-being. And we know that if we get better outcomes for the mother, we get better outcome for the baby and also for the whole wider family, and those differences again really make a difference throughout a child's life. The new 0 to 19 model is a brilliant opportunity for health visitors to be far more engaged with the early help teams. They'll be very much placed at the centre of the early help teams, and that really close working with children's services will be invaluable to meet the needs of children and families in a way that makes most sense and can be shared across that multidisciplinary team.